Yeah, go.
Hi, how are you doing today? My name's Keaton. I'm going to be taking care of you. Can you just say your name and date of birth for me? Ann Barnes, correct date of birth. Alrighty. So, do you have any allergies or recent surgeries? Nope. Alright, we're good to go then. So, what we're going to be doing today is we're going to be putting in an NG feeding tube. And all that is this tube's going to go through your nostril, down your esophagus, in your stomach, and that way we'll be able to feed you. Raise the bed up a little bit. Alright, I'll put this towel down to keep you clean if anything happens to spit up. Measure how far the tube needs to go. So we go from the tip of the nose to the tip of the earlobe, and from there down to the xiphoid process, which is right here. I will mark this with a piece of tape. Alright, got it marked. Set a cup of water, or first let's see which nostril we should use. So go ahead and breathe out for me. Alright, one more time. Alright, so I think your right nostril is probably clearest, so we'll go with that one. I will set a cup of water here, and when I tell you, I'm going to need you to take some sips so that this will go down your esophagus easier. I will lubricate the end of this 2 to 4 inches. It's lubricated. Alright. Now, tilt your head back for me, and go ahead and start sipping when I tell you to. The patient's head is tilted back, so sip, 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 sip. And at this point, when you reach the pharynx, we would stop if the patient has any cyanosis, gagging, coughing, or they cannot speak, and we would remove the NG tube. So now the patient tilts their head forward, and we continue to sip as I keep going down. Just keep sipping, sip, sip, sip. You continue to push it down until you reach your marked tape. And so then I will take this. It's taped, secured, with a cup of water. And now we load the bed, send the patient to get an x-ray to confirm the placement of the tube. When the patient returns, the tube is confirmed to be in the correct place. So now it is time for us to take out the wire in order to feed the patient. Wire is removed, placed in a disposable bag. So then you're now able to feed the patient. When it's time to remove the tube, alrighty. Now we're gonna remove the tube, and so I'm gonna take this tape off, and whenever I say, I'm gonna need you to hold your breath, but I'll tell you when. Get this tape off. Alrighty. It's gonna take a deep breath in for me. Alrighty, and hold it. Alrighty, I will take this, place it in a disposable bag, and I think that's it.